But let's get into tonight's call. Dr. Harris, you're there, right?
I am. How you doing, Ken?
Good evening. You and I have had a chance to visit over the last few days, and I'm fascinated with your story. I know you live in Southern California in Riverside. Why don't you tell our listeners tonight where you studied and what medicine that you specialize in, would you please?
Okay, absolutely, Ken. And first of all, I just want to thank you so much. I am so humbled. I'm so grateful. I have listened to just some phenomenal physicians that precede me on these doctors' calls. So I really feel that it's an awesome privilege to be able to be invited. So I just want to thank you, Ken. I met you over at our great event in Cerritos. I had the opportunity to present. So meeting you was wonderful. Meeting all of the other people that's part of the family was awesome. I feel like I needed a ladder to really give you a big hug that I wanted to, so as tall as you are. So thank you so much for the privilege. So, yes, I grew up in New York, and so I do know that there's some New Yorkers on the line. I heard them, and I did train at Cornell Medical School. I graduated in 1986, and that's when I moved to California to do my residency training at LA County, USC, and I decided to be an OBGYN. So I did that for 15 years straight with the full OBGYN practice. In 2005, because of a lot of just personal things going on with myself, with remarrying and having to raise 5 children, and ministry, I knew that there was just a little bit too much on my plate, and that's when I backed off from the obstetrics part of the practice and just focused on gynecology. So, and then I will just add to my story that back in 2002. When the Women's Health Initiative came out and just scared everybody about hormones, that was something that was a real turning point for me. I decided to start looking at how I was practicing and doing better for my patients. I didn't feel like I was doing the best because in conventional medicine, we really are not fully trained on every single thing that people can be in need of. There was just really too many patients, to me, not being managed properly for a lot of their thyroid problems, GI problems, adrenal problems, sex hormone problems. And so I had to just step out on my own and do my own training and go to seminars and read books and get training, through compounding pharmacy as well, so that I could learn how to do something different.
And that's what I was fascinated with when you had a chance to speak to our distributors in Cerritos, California. And I'm happy you gave a shout-out to California as well as that New York ties that you have. Yay. Can't leave that. And really, there's a whole NewULife family now across the country that will all become your best friend by tomorrow. But I think I asked you the question, what was life before with yourself and your practice before you were introduced to NewULife and Somaderm? Tell me just a little bit about what you were going through and maybe with your practice, what you're looking for, what you saw a void in. Just share with our listeners tonight a little bit about that.
Sure, yeah. I do bioidentical hormone replacement. So after practicing at multi-specialty group and then going on to another large organization, this was in 2015. So after 25 years of practicing, I said, something, I need to be able to practice the way I want to practice. And that's when I stepped out on my own and just opened up my own private practice. So that enabled me to be able to just freely take care of people, like I said, the way I wanted to, and offer them options, offer them different things, nutritional supplements, lifestyle changes, things that, to be honest with you, sometimes you don't have the time to sit down with people to really give them, to look at the whole picture and say, hey, these are different aspects of your health that we need to address. And if we don't look at everything, we're really not taking good care, at least in my mind. So NewULife came around. I was very, very open to it because I've been using products and trying to help myself since really I was in my mid-20s. I was, did different companies in the past. I've always been about just supplementing myself and doing things that I want to do and being proactive with my health and wellness. I'm very, very passionate about what I do for myself. I'm into aging very, very gracefully, and I want to share that information with other people as well.
So you got introduced to Somaderm and NewULife.
Yes.
How long has it been now? How many months?
Wow. That's right. Well, my brother, Rico, through my wonderful business partners, Jody and Peter Hugenoff, introduced it to me in the later part of July of last year. And I started using it as soon as I got it. In fact, I squirted too much on myself when I first got it.
So you first put yourself out there as a guinea pig for your patients?
I sure did. I had to try it for myself. I wanted to see what kind of response I was going to get for myself. Because, testimonies are very powerful. And, not that I have to try every medication that I give my patients, and I really try to do low amounts of medications and more supplements, but we're all different. So I have to address people where they are. But for me, I'm 58, almost 58 years old. I've been in menopause since 47. I've been on bioidentical hormones since then. And so when I looked at what it was, I knew that I needed to try it for myself. And, of course, me being able to have my own personal testimony, I think that's something that says a lot.
And what did you notice after being on it before you started sharing it with your patients? We'll talk about that in a minute.
Sure. Wow. Okay. Well, like I said, at first I think I used too much because I was so excited. I used a lot of it, I have to admit. And I kind of almost had like an opposite effect because of that. But once I figured out how much I needed to use and the dosing that I needed to use, the frequency of, I should say the time, I kind of started off feeling, okay, this is a twice-a-day dosing, so okay, 6 o'clock in the morning, 6 o'clock in the evening. But what happened to me was when I used it too late, that first couple nights, I would wake up, I woke up literally at like 2 o'clock in the morning, like my eyes were like bing, I had all this energy, I wanted to go and clean the garage or do something like that. I had so much energy, I'm like, no, this is not good, this is not the time for this. So I had to figure out what time I needed to use it for myself. So energy was one of the first things that I noticed. I no longer had that afternoon slump that everyone talks about. They say after lunchtime I just conk out. I just die after lunchtime, and I just have this slump in the middle of the afternoon. Not me. I had energy all day long and was able to get enough out of my system so that by the evening and night I was able to have great sleep. And I really didn't think I had a problem with sleep. But when I started having deep sleep, it was amazing that how I could wake up. It didn't matter what time I woke up, whatever time my body needed to rest, I woke up, I felt rested. It wasn't that groggy, slurp yourself out of bed. It was tremendous amount of just get up and be energetic. Another thing I noticed was my joint discomfort in my left knee. I no longer had to use a brace on my left knee when I went to my Pilates class. So that was amazing. Just mental clarity was very enhanced. I have to be sharp. I'm speaking to my patients. I'm handling situations. I'm multitasking, and so that mental clarity was there. Belly fat started just going away. I'm very tuned into my body, and I know when I got more there than I should. And then sometimes it's just hard to explain to people when you just feel good. When you just say, I just feel good, and all I say, oh, I feel good too. No, you don't have my good. You need to have this kind of good. You need to try my good so you really know what good is. And Ken, literally at the 3-month mark, my hair, and I know we have to be compliant and everything, but I do know the difference between fullness and thickness and length. My hair grew. So at my 3-month mark, my hair was significantly longer to the point where my hairdresser even commented twice. And I had to let her know, yeah, this is the gel that I've been using. I've had family members that have had very similar types of testimonials as well, as far as just joint joint aches and pains being relieved, energy with and endurance when they exercise, weight loss. I mean, there's a variety of different things. It's not just me. I mean, there's a tremendous amount of people that have such awesome testimonials. And like I said, me personally, as well as family members that I know I can speak directly to, as well as many other people as well. So, yeah.
So we're going to get into your patients in a minute because you shared with me that you do put some studies on them and you kind of watch them going through the process. But basically what I'm hearing from you is a lot of the things that we promote, what an increase in HGH can do for the body, you started seeing them within 30 days. And I think it'd be nice to share with the people how much better it gets as you continue using the product. Share with us that just on your own experience.
Yes, absolutely. And, so that's one of the things that, sad to say, because people want instant results. And yes, there are some things that people can experience within the first few days, the first week, the first 2 weeks. I do understand that. And again, it meets you where you need it. So if sleep problem is one of your issues, you might notice that you have improved deep sleep within a few days or a couple of weeks. That might happen to you. But, it may take a little bit longer for the weight thing to start kicking in. So being able to be patient and allowing this process to take place is one thing that I will like to emphasize. I have a couple things that I really want to emphasize. 3 to 6 months, because the HGH is getting into your system, but it's causing a slow rise over time. The other ingredients that's in there, my feeling is that you've got a lot of different, botanical ingredients that's working like quickly. You've got your adrenal support. You've got your thyroid support that's kind of like in that middle there. And then you've got the human growth hormone that's slowly helping your pituitary gland to secrete on its own. And some of those things you may not notice until like after that 3 to 6 months. So duration and patience and sticking with it, being consistent, using it as directed. Consistency is key. My mom, I love my mom. Mom, are you using it? Yes, Leita, I'm using it. But she still has the same bottle when I first gave her. So you got to use it. Mom, use it like I'm telling you to use it. So consistency, using it as directed and giving it time. And then finding out what the right amount is for you, because it does take time for some of the other things to slowly manifest. Again, my hair didn't kick in until 3 months, so.
Well, the thing that I was impressed with is that you said that unlike a lot of doctors, you stepped down and started looking at alternative things, and you started using nutritionals for yourself. And you mentioned those, and that probably went all the way from multiple vitamins to antioxidants to you name it, herbs and whatever. Mm-hmm. But you absolutely noticed a difference with NewULife Somaderm Gel versus some of those other things. Not that they weren't good, but there was a significant difference in taking this product. Right. Am I correct in that?
Right. Absolutely. Absolutely, because I'm on bioidentical hormones, and so and what I would like to share with everyone is that there's a lot of hormones in our system, in our body. There's lots of hormones, and so when you are addressing some, but not the others, it is not going to be good balance. And so even with me being on my bioidentical hormones, and even with me doing other things as well, I still noticed an improvement. And because of the fact that some of those other things I was using in capsule form, I just removed it. I stopped using it because I was able to get the ingredients so simply using a gel and rubbing it through your skin instead of having to ingest and swallow a capsule. So that was something that even with me doing what I was doing, I was still able to notice a significant improvement for myself.
Oh, fascinating. It's been very interesting. So let's talk a little bit about your patients. As you said, you've kind of dropped the OB and you're mostly into gynecology now. So you do, and I looked on your website and your card. You're involved in nutrition. You're involved in hormone replacement. You're involved in a number of things with your patients. So you're really a full provider. And I told people when they said, how should we promote you? I said, well, every woman should be on the call tonight in NewULife, and every man who's either has a girlfriend or is married to a woman should be on the call tonight to listen to you.
Right.
You probably have a lot to share with some of your patients that you've seen results, and I believe I asked you if you were drawing blood, and you said yes. So you're looking at actual blood samples to see what's going on. Would you share with us?
Right, and what I do, because I'm not going to, I want to be very genuine here. So a lot of my patients, of course, when I monitor patients who are on bioidentical hormones, I do blood work on them. When I'm monitoring your thyroid, of course, I'm doing blood work. I'm checking a variety of different things on a whole health panel. So that's how I'm monitoring. What I have found is some of them, again, who are using it consistently, some of them have been able to stretch out the time of them getting their next pellet insert, because I use hormone pellets as well. Some patients choose to use the bioidentical estradiol and testosterone pellets, and so they've been able to kind of stretch it out a little bit. What I do tell patients who are on thyroid, either when they come to see me or if I place them on it because I want optimal levels of thyroid, I'm going to say that, because there's too many times where people are clearly hypothyroid. They've got Hashimoto's thyroiditis, they have an underactive thyroid, and they're being told everything is fine because their TSH is in this ridiculous range that's given in a lab. So yes, when I start them on this, as you know, and with anything, I retest. I see how they're doing. I see, and many times I share with them, you may be able to reduce. I haven't had to do it as of yet because I haven't had anyone on long enough, but you might be able to reduce your thyroid hormone when you get on this, because of the thyroid glandular that is supporting your thyroid to function better. Yeah, so we're trying to get the glands that's already in your system, your adrenal glands, your thyroid glands, to function better, so that you need less of a replacement, and some might even be able to come off altogether. So yeah, we do monitoring as well. Yes, absolutely.
You know, I speak with a lot of health professionals like yourself, and I mean all the way from nurses, chiropractors, DOs, doctors, surgeons, all the way through it. And I think, quite uniquely enough with NewULife, we have in excess of 800 health professionals, and I know I'm asking a lot, especially like yourself, that draw blood. Were you looking at the IGF-1 levels as well?
To be honest with you, I didn't. I know that there's other physicians that have done that. I just, I guess I was so excited to just do it that I haven't. But believe me, I'm telling patients, and I know that there's other doctors who have monitored IGF levels. I definitely know that, and they have seen improvement, anywhere, and correct me if I'm wrong, anywhere from 1 to 5% increase over time of IGF-1 levels, which is the way that the human growth hormone acts onto all of the other tissues in the body, is through the IGF-1, which is, metabolized in the liver. So I didn't do that. And like I said, I guess I was just so anxious just to get on that I wasn't even looking at, okay, well, let's see what's before and what's after. But I do know that there's other physicians that have done that, and very credible doctors who have done that and actually have known and seen that there has been improvement there. So,
And from your experience with hormones, why would you think, just let our audience listening know why that's important to recognize that and to see that happening, the value of that you're getting to your body?
What's the value of which? I'm sorry.
Of the increase in the IGF levels.
Oh, yeah, because that is the way that the growth hormone is actually going to exert its effect. So you have the growth hormone that's secreted from the pituitary gland, and it affects the whole body through mediation of IGF-1. So that, like I said, growth hormone goes to the liver, and then IGF-1 is created. And that then consequently affects the brain. It affects the cardiovascular, musculoskeletal growth. It's the ovaries, the testicles, the thymus, your immune system. So that's the way the growth hormone acts, and that's the way it mediates all of its actions on all of the other peripheral tissues. And you've got receptors all over the body for that. So if someone wants to, go ahead and do before and after and watch it and monitoring it, by all means, they can do that. Some people, they just want to see how they're doing. They just want to judge from what they're feeling and how they're doing. But if you want to have a way to actually quantify what's going on, then by all means, that can be done. But, again, if someone may not have someone who's going to draw that for them, that's willing to do it for them, but they certainly can look at their body and see how they feel and see what they are experiencing personally as far as the different changes that they can notice over time.
Great. And I would agree with you. And they will see it. If they're really, as you said, I think you really hit on a couple of points. Use it correctly.
Yes.
Take the dosage that's right for you. Don't worry about finding out what is the right amount until you find out what makes you feel different, right? I mean, we do put out a standard dosage, one pump in the morning, one pump in the evening, then you've got to work from there. And we do find a lot of people trying to stretch it out that don't get that feeling. And we get calls to the office saying, I just haven't felt anything, and we find out that they've been trying to make one bottle last 3 months, and it just
exactly.
work in that way.
Exactly. You have to use a proper amount over a period of time, and I love that. It's like, oh, it's not working, and then when you start questioning, you realize that's why it's not working. You're not using it properly. So,
So in summary, and we do certainly appreciate.
Oh, we have to get off again. So soon.
Yeah, let our listeners get back. But in summary, why don't you just kind of sum up your feeling of what you feel that Somaderm can do for our listeners tonight, and any of their friends or customers that they want to get on the product, just from a doctor's point of view. Just a quick summary. We'd love to hear it.
Sure. I mean, we're all aging. I mean, we can't go backwards as far as numerically. Yes, we're all adding on numbers, but there's a lot of processes that's going on with the body during this aging process. And so anyone really, I know that the growth hormone levels drops after, 25, 15 even. So, but people who are over 30, 35, start noticing the changes that are happening with aging. And so anyone, man or woman, who essentially just wants to experience better health, they want to feel better, they have to understand that there's individualized response that they're going to have. This product is for everyone. Now, whether or not everyone uses it or not, hey, they have to want it. They have to desire it for themselves. People spend money on what's valuable to them, right? So for me and for those who feel that their health is valuable, it is more than worth the investment, and it is an investment. An investment means that you're putting something in and you're going to get a return from it. You're not just throwing money away on something that's going to, get faded off over time. You're using and you're investing in your health. So many people are so quick to dispute what we have such as a valuable product without even trying it. They have all the answers before even trying it. And I also want to let everybody know you're going to get pushback, because not every physician is open to something like that. You're going to get pushback, but don't worry about it. You just got to keep speaking about it. You got to keep sharing about it. I'm going to keep, sharing with, people, my friends, the people I care about, my patients, because I know it's an amazing, just something that helps to complement everything that I'm doing for them. And if they're willing to just, rub some gel on their wrists or behind their knees twice a day, they can have such amazing improvements in their health over time, and because of how everything just works so synergistically with one another. So we got tons of just great products, great ingredients in it. It's not just the HGH. Don't go Google HGH. It's the adrenal support, the thyroid support, it's the botanicals, it's the blend, it's everything that's going to make a difference with working synergistically to help you just to feel and to look your best. And I would recommend it highly.